So it took just 15 months for the coronavirus to kill more than 600,000 people here in the United States. It is the highest official death toll in the world. But the death rate has significantly declined over the past few months, thanks largely to vaccination efforts nationwide. But the Delta variant, first discovered in India, is becoming a growing threat to unvaccinated Americans. Dr. Anthony Fauci spoke about it earlier on CBS This Morning. Here is some of what he had to say.
It's a variant that in England has sort of taken over. More than 90+% of the isolates in the UK are the Delta. It's concerning because it spreads clearly more efficiently than the one that we've been normally dealing with, and it tends to look like it might even be more serious in making people ill.
All right, so Dr. Susannah Hills is a pediatric airway surgeon and an assistant ENT professor at Columbia University Medical Center, and joins us now to discuss more on this topic. So, Dr. Hills, this is a pretty somber milestone, and it's coming at a time that many states, including New York and California, they're reopening almost fully and even celebrating what they see as the beginning of the end of the pandemic. Are we right to celebrate now, or is it a little too soon?
Yeah, that's exactly the question that the point that we're at right now, and we reach this point where we have almost a majority of Americans fully vaccinated. There are over 44% of Americans fully vaccinated. And over 53% have had one shot. I think we're entering into a phase where we can start easing some of our restrictions, which is really a wonderful thing and something to be celebrated. But when you take a closer look at exactly where the vaccine is going into arms, there are significant pockets geographically and within different communities in the United States where there are real disparities in their communities at risk. If you look here at New York, for example, we see that, down in the financial district, almost 100% of people have been fully vaccinated. But if you look at Far Rockaway, only about 34% have been vaccinated. In terms of, Black New Yorkers, about 32% of Black New Yorkers have been vaccinated, while over 70% of white New Yorkers have been vaccinated. So it's a really challenging, a challenging point that we're at. We want to celebrate the fact that, we've come this far and we have had this significant success with our vaccination program. But my concern is that we're going to start feeling like we don't have to continue to push forward, that our work is over. And while this may be the end of pandemic conditions for the moment here in New York, it's not the end of this virus, and it's certainly not the end of the pandemic globally. If you look globally at what's going on at India, at Brazil, at the rest of the world, there have been just massive increases in cases over the last few weeks. We've gone from 120 to 150 million cases globally in the last 6 weeks. So we still have a lot of work to do.
The Telegraph reports that vaccination experts in the UK are expected to advise against the rollout of vaccines for people under the age of 18. What are you hearing are their concerns?
So I think they're concerned primarily about the lack of data in the pediatric population. They're holding off a little bit longer on broadening vaccination to kids under 18 years of age. With the Delta variant now being the dominant strain in the United Kingdom, I'm frankly a little bit surprised that they're not pushing forward with vaccination in younger people. We know that this variant gives about a 2 times higher rate of risk of hospitalization. It seems to be making people significantly more sick. And getting 2 doses of vaccine really does provide adequate protection, it seems, against this variant. So in terms of getting kids in the UK back to school safely, in terms of protecting communities and achieving a level of herd immunity that is protective in the UK, I think it's, a decision that I don't fully understand. And I definitely think in the United States, our progress with vaccinating kids has been impressive and really important. And I'm really pleased to see so many kids who are 12 and up getting vaccinated, and so many families willing to to get their kids vaccinated, to protect their communities, their schools, and to keep their kids safe.
So speaking of kids, we've had a lot of conversations about just how this pandemic is impacting kids, their emotions, and, their progress in school. But now we have something called pandemic babies. These are children who were born during the pandemic when everyone was locked inside. And so they had, limited interaction with family members or other adults, and certainly other children as well. And they are emerging into the sunlight, into playgrounds. I'm curious about the impact that, the quarantine may have had on the development of these babies.
Yeah, Anne-Marie, I think the impact has been broad. From the very youngest kids born in this pandemic who have had delays in child visits and in vaccinations, to older kids who have really experienced the stress and emotional effects of this virus, and the social limitations that they've experienced during the last year have been significant. And looking at child visits and vaccination, here in New York City, back in April and March, there was an 82% drop in early intervention visits and support visits for kids who needed things like speech therapy, occupational therapy, physical therapy. So kids who needed special services, older kids who need more ongoing support and care. That really fell off of the radar during COVID-19 because providers weren't available to come to kids to give them therapies, to give them the services that they need. There was a significant fall off of those services. And then, to go back to vaccination rates, in New York, they dropped about 91% between March and May in New York. So from the earliest kids, needing vaccinations and child visits, to kids needing therapies and support, they've all been significantly affected, or certainly the vast majority. And in my own practice, just yesterday, I saw 3 families that I can think of off the top of my head whose kids had significant speech delays and hadn't been getting any kind of speech therapy or early intervention evaluation to help with that issue, to get them the speech therapy they need at all. And these kids were now 3-4 years of age and well beyond the point where they needed services to help catch up. So there'll be a lot of catching up to do. Schools will really have a significant role to play, and it will really be incumbent on schools to help kids move forward and get these special services that they might need. And the next year we'll have a lot of work to do catching up.
All right, Dr. Susannah Hills, always great to talk to you. Thank you so much. Appreciate it.
Thanks so much, guys.